I'm Rosalind. I'm going to be talking about blood counts in pediatric oncology. So I think this presentation could be useful for nursing students. It could be useful for like new nurses or new staff on an oncology floor. And I think it could also be useful for patients and families who have recently had a child diagnosed with cancer. Some of the terminology is a little bit advanced in medical, but these are terms that we're using around the families on a regular basis, and I think it's good for them to know those terms and to empower them to know more about their child's care. So here are my objectives. I will not read them out loud to you guys, but you're welcome to take a look here and see them. And before I get started, I just want to give a little background on why pediatric oncology patients might have low blood counts. So the primary reason that we'll talk about and you'll hear about is chemotherapy. So chemotherapy is used in most pediatric oncology patients, and when it kills the cancer cells, it just has another side effect where it also kills healthy cells. So those red blood cells, those white blood cells, those platelets we're going to talk about, those all get killed when they're killing the cancer. And that's definitely a huge side effect that we deal with these patients. The other reason that these patients might have low blood counts is because, for example, in leukemia, it's a bloodstream cancer. So the cancer is in their blood. Those leukemic cells are actually taking up space in that blood. And because the leukemic cells are crowding out the blood, they're actually decreasing the amount of other types of cells that can be in the blood. So the red blood cells are lower and the platelet counts are lower because the leukemic cells are taking up so much space. So those are the main reasons why we see low blood counts in these patients. The first type of cell we're going to talk about are red blood cells. Red blood cells carry oxygen. We typically will look at the hemoglobin to determine if they're anemic or not. Low hemoglobin is anemia. So it's an indicator of red blood cells and how well they're functioning and carrying oxygen. So as far as the symptoms go, you can see them there, but it's a lot of exhaustion. The patients just don't feel good. They might be, just wanting to lay on the couch when the parents are used to them being really playful and having a lot of energy. They might also be pale. They could have some like rapid heart rate or tachycardia. Shortness of breath is another symptom. And then especially, in I feel like teenagers, they have a lot of the headaches and the dizziness that can be really, really distressing for them. So the good news about red blood cells is that we can transfuse them. So when patients' hemoglobin gets too low, we will transfuse them. However, we definitely look at the symptoms as well. So, if they're supposed to be transfused at a hemoglobin of 7, but they're super tired and their heart is racing and they've been dizzy all day, we're going to transfuse them even though their hemoglobin isn't 7 because we want to make sure that they're taken care of. Otherwise, there's not a whole lot we do about increasing red blood cells in this population. The counts will come up on their own when they're finished with chemotherapy, back to normal levels. Okay, platelets are the next type of cell we're going to talk about. So platelets are the blood cells that stop bleeding. So they go in and they form clots that would normally stop you or I from bleeding. For example, we skin our knee, it's a little bit of blood is coming out, but it stops in like 2 minutes because of our platelets. So this population is just at really high risk for bleeds because the platelets, there are not enough of them to do their job. So you're going to see, you might see GI bleeds, there's nose bleeds, we worry about cranial bleeds, and definitely if they're symptomatic with those bleeds, we would be likely to transfuse them with platelets. Additionally, if their platelet count is low, like 10,000 is what we generally would transfuse at, even if they're not symptomatic, because they are at high risk for those bleeds I was talking about. Bruising and petechiae are other symptoms. So petechiae is like little dots on the skin. They're like red or purplish, and they can indicate that a patient has low platelets. These aren't quite as distressing, but they are common. And I've actually had patients before who the only reason that the parent caught the leukemia was because they were so bruised, and they were just concerned about the bruising, and they took their kid to the ER because they didn't, they wanted a second opinion when their primary care doctor just didn't think it was a big deal. So it definitely can be pretty severe. The other things that you can do when platelets are low to kind of minimize the effects would just be avoiding contact sports or anything that would make you bleed. Another thing, people will generally continue with their mouth care and brushing teeth, but you may feel like you need to stop flossing, because flossing can actually cause like some pretty severe bleeding from the gums when your platelets are low. So that's just kind of up to the individual if they were flossing and they want to stop while their platelets are low. The other thing I didn't say is, in the medical field, this is called thrombocytopenia. So thrombocytopenia is what you're just going to hear instead of low platelet count when the doctors or nurses are talking about it. And then the last thing we're going to talk about is white blood cells. So white blood cells fight infection, and we generally talk about a patient being at really high risk for infection when they're neutropenic. So that's when their neutrophil count is low, and neutrophils are just an important type of white blood cell that we use to indicate how well they can fight infection. So when patients are neutropenic, they're just at very high risk for infection. They can get fevers that are related to infection, or they can get fevers that are just random as well with neutropenia. But because if you don't know whether it's an infection or not, which we usually don't, they are going to need antibiotics. They're going to be hospitalized because it can be life-threatening, especially if they have a central line, because of bloodstream infections are just it's such a scary thing for a child to get a bloodstream infection, so we can't take any risks. And they will be put on IV antibiotics if they have neutropenia and a fever. Other things they can get, all sorts of bugs that only immunocompromised people get. So like fungal infections in their lungs. I've seen fungal infections in the livers before. GI bugs you've never heard of that are really gnarly. Pneumonia, and just anything. So it's really important that whenever patients and families or friends are visiting with outside folks that may carry germs, that those people wash their hands really well, and that everybody in the house is washing their hands really well and doing really good hygiene. It's huge for these patients so they don't get infections. I have a little figure here that just kind of shows some ways to prevent infection I thought was good. So you can see hand washing, very big. We want every family to know that. Also, this is like teeth brushing, mouth care, very important. A lot of studies has shown that good mouth care can reduce central line infections. And then the third little picture here is about sick contacts. So you do not want these patients around other sick people. If they can, give them a few days to get over their symptoms and start feeling better, that's going to be really, really helpful for the patient. So avoiding germs. All right, to wrap up, we're going to do a little case study. So Macy is a 2-year-old patient with leukemia. She finished her chemo about a week ago and is back home with her parents. This morning, Mom noticed a small amount of blood in her urine. What is this likely a clinical manifestation of? A, neutropenia, B, anemia, C, thrombocytopenia, or D, the red popsicle that she ate last night. I'll give you guys a second. Alrighty, so the answer to this question would be thrombocytopenia, because that's low platelets. So low platelets often cause bleeding. This would definitely be something that if they were at home, the family would want to let us know about, because it could be that their platelets are very low and they need a transfusion. All right, here are my references. And then to finish off, I would like to just show a little clip from a website that I am very fond of called the Imaginary Friends Society. It has a bunch of little videos for kids that have cancer, and kind of tell them what to expect. So enjoy.
The Imaginary Friends Society presents blood transfusions.
Hello there, pal.
You can call me Mr. Spikes. Huh? Whoa, stop it! I'm a Tyrannosaurus robot, for Pete's sake. Oh yeah, that's better, oh yeah. Tyrannosaurus robot explains blood transfusion! Tyrannosaurus robot explain... Oh, hi. I'm an imaginary friend of a kid just like you. I hear you're up for a blood transfusion, which sounds intense. But blood transfusions are actually quite common and painless. Before we can talk about transfusions, though, let's talk about blood cells. Blood cells are like superheroes, each with a different superpower. White blood cells fight off bad stuff inside your body. Red blood cells deliver oxygen and other good stuff to your body, and are the most common. See, treatments like chemotherapy zap away the production of red blood cells. So you don't get the good stuff, and it can make you sleepy. Insert good stuff to continue. Insert good stuff to continue. Insert good stuff to continue. Insert good stuff to continue.
1 hour later.
A typical blood transfusion only takes 1 to 4 hours. Best part is, no special recovery time is needed. You'll feel the effects almost instantly and have energy to attack the day. Ha, hoo, ha, hiya, hee, ha, ya.
Showing off is the fool's idea of glory.
Whoa!
Okay, everybody, thank you for watching.